Hey there, I'm Dr. Jim. Thank you for stopping by. I have a serious but an interesting topic to share with you this week. Two topics that I have studied for a very long time, HIV and aging. I was a teenager in the 1980s. Where were you in the 1980s? What were you doing? But I remember learning about AIDS and HIV on television, the nightly news, when Ronald Reagan came out and told us about it. Quite frankly, I was terrified. I was absolutely terrified. Is it in the air? Is it in the water? Do I look at you? Do I touch you? How do I get this? So on and so forth. We knew so little. We really did know very, very little. Fast forward almost 40 years now. Amazingly, people with HIV can live a very long time as long as they stay compliant with their medical treatment. As a gerontologist, I've been so interested in aging with HIV and what it must be like. So I looked into it, did a little bit of research. That's what I want to share with you now. Older adults at risk. I went to the Centers for Disease Control website, the CDC, and they indicate this: older people in the United States are more likely than younger people to have AIDS at the time of diagnosis, which means they start treatment late and may suffer more immune system damage. Think about that. That can lead to a poorer prognosis, a shorter life expectancy. Older adults may not be as knowledgeable or informed about HIV risk factors as younger people were or are today. One such reason: physicians and healthcare professionals don't generally ask older adults, say 65 or above, about their sexuality, their sexual behaviors, or their drug behaviors. It's just not in their vernacular when they're talking to the patient. And older patients in general, I don't want to stereotype, but in general, they don't really like to disclose a lot of private information about what they do behind closed doors. They don't really believe it's the doctor's, it's just not for them to know. Okay, none of their business. So much of this vital information then gets totally lost in translation. Aging with HIV, sadly, people diagnosed prior to the advent of the antiretroviral therapy, or ART, their life expectancy was only 1 to 2 years at best. And when I look back, I love entertainment. I love music. If I wasn't doing this, I'd be a punk rocker. You know it. We've lost so many great people. Freddie Mercury, Rock Hudson, Liberace, what a guy, what a character. Anthony Perkins, Robert Reed, Arthur Ashe, Perry Ellis of the designer world. How many wonderful people have been lost? So many more. It would take me hours on this video just to go down their names. But with such a short life expectancy, nobody was focusing on growing old. But we are growing old now. We're living with HIV and actually managing it into very old ages. People are living longer. But think about this. They are still aging. And they're aging with age-related disorders that normally would accompany age: arthritis, diabetes, Alzheimer's, cardiovascular problems, right? These can complicate the conditions associated with HIV. Do you understand how complicated this gets then? Some older adults develop multiple chronic illnesses, age-related, with the HIV-related disorders. Complex. It's so complex I can't really get into it in this video. It's too short. So I wrote an article. Here it is. HIV and Aging. Please, after you watch the video, click the link to the article, read it, share it with everybody. To learn more about this topic and many others, and to get some CEUs, go to ceu.academy. Read, learn, earn CEUs, and spend more time with me, Dr. Jim Collins. I'll see you later.